you very much, Nurul. So we can go to the next stop. And if the time permits, we'll have further discussion at the end. Can I invite the next speaker, Dr. Mahua Rai? She is a consultant pediatric cardiologist, Narayana Health, Kolkata.
Good evening, everyone. Thank you, organizer, for giving me opportunity to talk in this prestigious forum. Without wasting my time, I would like to start my talk. My talk is understanding of hardware, that is stent. If I show you this specific case scenario and ask you what kind of stent would you like to put in such scenarios, like discrete coarctation in an adult or transverse arch coarctation or near interruption in Turner syndrome patient, or maybe this one, that is MAPCA dependent circulation in an adolescent boy, or maybe branch pulmonary artery stenosis, unilateral branch pulmonary stenosis in child, or maybe newborn with ductus. I know that I will get the right answer for most of the time. But if I ask you why you have chosen that particular stent in that particular position, then I may not get right answer for every time. We pediatric cardiologists are fond of devices. We know A to Z of devices. But adult cardiologists who are dealing with coronary intervention, they know stent better than us. Normally, we choose a stent because we have seen our seniors have chosen that stent in that particular position. So today I would like to throw some light on the basic of stent so that you can choose your own stent. History-wise, first Daughter and Judkins use a spring-like thing. Later on, Palmer and Charles Mullin used the proper stent. Yeah, here you need to understand that although this is the standard of care, till now it is not FDA approved. So you might be thinking, why should I break my head on stent, whereas we are having lots of balloon? Because stent is sometimes necessary. Balloon is not the answer. Like that, if you are dealing with a long segment stenosis and hypoplastic vessel, then the balloon is not the answer. You need stent. And sometimes like that, a total occlusion of vessel, then balloon cannot do the justice. Whereas in certain structure like ductus, the newborn with ductus, there is no terminology of balloon dilatation. You have to stent it. Then stent bed can be classified into various ways. Don't be afraid, no need of remembering anything. Just try to understand. Material wise, there may be stainless steel stent and the prototype is Palmer stent. You need to know that there is a coding type of thing written everywhere. That is here, this is 316. Don't be afraid, it is the combination or the amount of alloy. Here in 316 means high molybdenum and L means low carbon. The prototype of platinum iridium stent is CP stent and the prototype of cobalt chromium stent is Andra stent. Material wise, the self-expandable stent are mostly made up of nitinol. And recently, the biodegradable stent is the talk of the town. There are various they are in experimental stages, and there are various materials are used like polymeric or magnesium or maybe biocorrodable iron. What does it mean by slotted tube or welded tube? Slotted tube means a small or desired length of the stent is started by laser from a long tube. The prototype is Palmer stent. What does it mean by welded tube? It is manufactured from a wire which is bended then welded. The prototype is CP stent. What does it mean by closed cell design and open cell design? In a simpler way, closed cell means the one cell, the corner of a cell is attached to the neighboring cell and which gives a good radial strength, but it is causing less flexibility. To improve the flexibility, some stent has improved by some designer modification, which gives high flexibility without compromising radial strength. What does it mean by open cell design? The geometry does not connect consistently throughout the stent, forming incomplete or non-bridgeable cells. This is somehow advantageous. It diminishes the minimization of foreshortening. It has got other advantages, like if we are dealing with a curve structure, then this open cell design can take the shape of that curve. There are other advantages like there is less chances of balloon rupture. But these are also not devoid of disadvantages, like it can causes high plaque protrusion. And there is a concept of hybrid cell, like in Andra cell, Andra stent, it is made up of open plus closed cell. Size-wise, stent can be divided into small, medium, large, or extra large. Small stent are mostly used in pediatric cardiology in ductal stenting part. What does it mean by balloon expandable and self-expandable stent? Balloon expandable stent means we have to crimp, or there may be a pre-mounted stent which is mounted on a balloon. Crimping devices are available, but I haven't seen that. We prefer hand crimping, but you can utilize umbilical tape. Balloon wise, it is written, it is theoretically, it is everywhere written that the bib balloon is preferred because opening the stent is more uniform, and there are other advantages. But there is some disadvantages. That is, if we are using bib balloon, then the sheath size has to be upgraded. So sometimes if we are dealing with a smaller tip, then we may use single balloon. And self-expandable stent, I have already mentioned, it is made up of nitinol. It is very super elastic. It is very low profile. It can take a shape of any curvature, but the radial stent is very low. You may think that is 10 to 20% additional expansion is written with the nitinol stent due to its memory. You may think it's maybe the advantageous, but it is reality. On reality, it is not advantageous. It leads to excessive intimal growth. So most of the time in pediatric cardiologists are only using such stents in where like that of surgical shunt, baffle, or conduit. What does it mean by bare metal stent and cover stent? Mostly cover stent is a thin cover made up of polytetrafluoroethylene or anything else. In case of CP stent, this is the covering. There are various advantages of cover stent, like if we are, it can rescue us from acute rupture or acute dissection. And sometimes in complex coarctation or near interruption, we should, this is a treatment of choice, this is a stent of choice. But it is not devoid of disadvantages, like it needs heavier, due to heavier profile, it needs larger sheets. And we need to take care of gelling of side branches. Nowadays, each and every cath lab, we are supposed to use only drug-eluting stents. So, because the adult cardiologists prefer drug-eluting stents, so we need to compromise here. We need to understand, is it really harmful for our tiny kids or not? Some papers are coming. They have shown really a sirolimus group of drugs is very high in day 1 or day 2 of after implantation of such device in newborn, but it's rapidly cleared off. So we may try to use such stent. And there is, I have already mentioned, this is a biodegradable stents are maybe it may be available within very few years. So the concept is very unique. It is causing a temporary scaffold, and it gives time for remodeling of the vessel, and then it disappears from the body. So I have already mentioned there are various type of things like that of that is the magnesium alloy stent. The problem with magnesium alloy stent is degrade very early, within few weeks, and it is not also radio opaque. So we need to add some gold to see the stent. There are growth stents concept. This is also unique. Two half of the stent is connected with PDA sutures, so it can gives a potentiality of the growth. Then how to choose our own stent? We can understand the arterial anatomy and the dimension is very important. We cannot choose the same stent for coarctation of aorta in case of adult or adolescent coarctation of aorta, and same stent cannot be used in neonates with DUC. But what does it mean by lesion specific or physical properties? Lesion specific means if we are dealing with highly calcified structure, fibrous structure, then we have to think a stent with high radial strength. If we are dealing in a fibrous with increased propensity to the thrombus formation, then we should take a stent with cover. Whereas, what about the physical character? I have already mentioned we need a good radial strength stent when we are dealing with a possibility of external compression. Now, I would like to mention one of these three. That is, what does it mean by remodeling, comfortability, and foreshortening? Remodeling means if we are working in a curve structure, like I have already mentioned, if we are dealing with a case of transverse arched worktation, then open cell design would be preferred one because it can take the shape of the transverse arch. Whereas if we use the closed stance design, then there is a chance of this may not remodel, and it should not be taken. So for this kind of structure, we should prefer open cell or hybrid stent. What does it mean by comfortability? If we take a stent in a curve or tortuous vessel, then there is a chance of a gap between stent and the vessel. So there is formation of thrombus formation is more. In such cases, the self-expandable stents are preferred. What does it mean by foreshortening? The difference between length of the unexpanded stent and the expanded one is known as foreshortening. Most of the time, open stent design causes less foreshortening. Here we need to understand that if we dilate it serially, then there is a less foreshortening. If we acutely dilate, that means if we dilate from minimum diameter to the maximum diameter, then there is a chance of foreshortening. So we should keep it in mind at the time of selecting. So what are the ideal stent? It must be low profile, high packetability, radio visible, MRI safe, compatible. It must be a predictable expansion with sufficient radial strength. We should understand that there is no stent which has got each and every ideal property. So we need to modify our choice according to the availability. So before
you can go to the last slide, please.
Yeah. So we have done this branch pier stenosis with formula stent. Then we have done this worktation in adult with non-covered andra stent, with this near interruption with covered andra stent. And this is by coronary stent. I was not bothered about the radial stent. I was only bothered about the flexibility and trackability. And this is done with formula stent. Thank you everyone for your patience hearing. You can go through these papers also. Thank you.
So thank you. So there was a very good review